Good morning. I'm Mike Neal, President and CEO of the Tulsa Regional Chamber. Thank you for joining us for today's Business Report Series, episode 13, Medical Trends and Analysis. The Tulsa Regional Chamber's Business Support Series offers insights on how your organization can effectively respond to the COVID-19 pandemic. There's an area where the Chamber can be of assistance to you or to your business. Please let us know. Our conversation today will focus on the latest medical trends and analysis of COVID-19. But before we get to our speaker, I'd like to thank the sponsors of our business support series. You see them listed on your screen: Expert Ready, Luxa Enterprises, Security Bank, and Stride Bank. And we're pleased to have with us Debbie Blacklock, Senior Vice President and Manager of Healthcare Banking for Stride Bank. I'll now turn it over to Debbie to introduce our outstanding keynote speaker. Debbie?
Thank you, Mike. It's an honor to join everyone today and introduce our speaker. Dr. Timothy Young is Chief Clinical Officer for Ascension St. John. The Ascension St. John Medical Center in Tulsa is a hospital offering high-level trauma care and more than 800 primary and specialty care doctors. This team of healthcare professionals has been on the front lines of our community's COVID-19 response. Dr. Young, thank you for joining us today.
Sure, thank you for having me. Thought I'd start out with a few brief numbers and just talk a little bit about the infection and where we are at this point. So currently, and these are state health department numbers that they update daily, but as of yesterday, they listed 3,410 cases statewide, about 316 in Tulsa, 207 deaths statewide so far, 17 in Tulsa, and about 2,260 who have officially recovered from the virus. Now, for the U.S. as a whole, we're a little bit north of 988,000 cases and about 56,259 deaths. Interestingly enough, a third of the cases and almost 45% of the deaths are in New York, and almost all of those are in the 5 boroughs of New York City. So really interesting cluster up there. So coronavirus, or COVID-19, is a member of the coronavirus family, which is the virus that causes your basic common cold. So obviously this one's a little bit novel for a coronavirus. Appears to have originated in China and spread pretty rapidly throughout the world, largely because of our globalized, travel-heavy culture that we have. So when this first started spreading, the first cluster was identified in late December in China, and we actually admitted our first case in Tulsa at St. John on March 15th. And by that point, it was well out into the community. There were some original estimates for how severe this was going to be for the United States that were pretty extreme. And I don't know how many of you have heard these numbers, but when the federal government was first briefed on it in January, they were tossing around numbers of 200 million in infections and millions of deaths. Fortunately, that hasn't panned out. The most commonly used model for Oklahoma was predicting a peak of the first week in May, at which point they were predicting over 5,000 inpatients from COVID, hundreds of intensive care unit beds being occupied, and many, many, many deaths. I didn't write that number down when the models were still up, but it was in the thousands. So where we stand currently are the numbers I gave you at the opening. And to me, one of the most important numbers is patients currently hospitalized, because that's really the impact on the healthcare system. As you know, this whole social distancing, closing down businesses, all that was to blunt the peak. So there's no treatment for this virus, and there's no vaccine for it. So if you didn't do anything, the fear was that hospitals would be full to overflowing, there wouldn't be enough ventilators, and we'd see unnecessary mortality. So that was the strategy that's been employed all across the country, and it does appear to have blunted the peak. But at our peak, a little over 2 weeks ago, we had 250 some odd patients in hospital beds across Oklahoma, and that number is now down to, I believe it was 134 yesterday. So if that was the strategy, it's been spectacularly successful. The healthcare system has not been overwhelmed. There's lots of capacity, lots of ventilators, and that's where we currently stand. So that being the case, the question is, how do you reopen? How do you get things going again? Because since we've been successful, the healthcare system has capacity. It makes some sense to start moving toward opening things up. Because once again, no vaccine, no treatment, you're still going to see the same number of cases, whether you see them all in 1 month or whether you see them in 6 months. So it appears to me that now is a reasonable time to start opening things up. The other thing that's happened in the last few weeks is that testing capacity has really opened up as well. So I was just talking to our lab folks here at Ascension St. John, and they can currently run over 5,000 tests a week, and should shortly have the capacity to almost quadruple that. And all the other systems in town also have testing capacity. So we can now test folks quite a bit. And by testing, I mean testing for actual virus in the nasopharynx. So that's that swab that they try and poke all the way through your brain to make sure they get a good sample. So lots of testing available. And what that means as we roll forward is that we will continue to see new cases. And the number of new cases may actually even go up as we can now test. In some parts of the country, they've done antibody testing, and their sense is that between 5 and 20%, that 20% number comes from New York, have actually been infected. Well, that's a huge number of people and nowhere near what we're seeing in the hospital or with test results. So I think what that means is that there's a significant reservoir of infected folks who have minimal to no symptoms. And that's part of what makes it hard to control this disease and hard to trace contacts and hard to do your typical epidemiology, because it turns out that 2 to 3 days before you show symptoms, you're already shedding virus. And add that to the fact that many people, even without symptoms, shed the virus. It's just hard to get a handle on this. So that's one of the challenges. As everyone knows, the severely affected folks tend to be older and with multiple other illnesses. And so those folks will probably continue to need to do some social distancing even as we ramp up. The governor has announced that hospitals can start doing elective surgeries again. And so we started to ramp up that business Monday. I'm pretty sure all the other systems in town are doing that as well. And we're going to follow a model of gradually reopening, and hopefully do that over the next couple of weeks. And by the middle of May, hopefully be fully open for elective surgical cases. As I mentioned, we're going to start opening up our physician facilities as well. So expect to see that as well. More physician offices open and more appointments available to see patients. One of the things that we've noticed both here and in New York and in several other places is that the number of patients with heart attacks and strokes has gone down, even though we believe they're still occurring at the same rate. And in particular in New York, a dramatic increase in the number of people being found dead, basically found dead at home. So we believe what's happening is that people with symptoms of heart attacks and strokes are so afraid of catching this virus, they're not coming to the hospital emergency rooms for the treatment that they need. And I just wanted to assure the callers that our hospital, and I'm confident the other hospitals as well are doing the same thing, are safe places right now. Excuse me. We're screening all employees every day as they come in to take care of patients. Everyone who has any patient-facing duties is wearing a mask all the time. And anyone with COVID is being cohorted to specific units. So we've also ramped up our disinfectant and cleaning procedures as well. So hospitals are safe. Your chance of catching COVID at a hospital is extremely low, and I would be pretty confident in saying you're more likely to catch it out in the community than you are at a hospital. So we need to spread the word that if you're having symptoms of something significant, come to the hospital and get it taken care of. We can safely take care of you. So that would, I think at this point, pretty much be my comments. So we'll open it up to questions at this point.
Thank you. Thank you so much, Dr. Young. I joked with him before we started and called him Tulsa's Dr. Fauci, but we appreciate your being with us today and appreciate your very thorough overview. I've got a number of questions for you, a handful that have been submitted in advance. We're not going to be able to take live questions, but I've got a number in advance. And the first one really has to do with, tell us specifically about Ascension St. John's response to the pandemic. You touched on this a little, but really about your response to the pandemic and what you would say is your healthcare system's readiness to handle an increase in COVID-19 cases, just in case they were to increase as people begin to come out of the stay at home and come back into the workplace over the course of the next month or so.
Yeah, so we expect the number of cases to go up, but as I mentioned earlier, we expect probably the majority of those to be mild or asymptomatic. So when all this started back in early March, we basically tried to clear the hospital out and go to sort of an all hands on deck strategy where we quit doing elective cases, and sort of we were helped in that because there was a lot of fear in the community. So anything people could put off, they did. So we ended up with a lot of capacity at the hospital, and I think that's universal here in town. So we are in a good position to take additional patients at this point. We have significant capacity, and we believe we're in a good position to handle whatever surge comes about as part of the reopening.
Thank you, Dr. Young. As businesses now begin to prepare to reopen, what precautions would you counsel their owners, their managers, as they prepare to have face-to-face contact with employees as they return, and likewise ultimately with customers as they return into the workplace?
Yeah, so good question. So probably a couple of different parts to that. Kind of depends on if you do your work outdoors or indoors. If you do your work outdoors, just the prevailing winds are very good at dispersing the virus. So probably minimal risk there. It's more of an issue indoors. And I think probably the best strategies are pretty much universal masking. So you need to wear a mask at work, and I'd suggest customers wear masks as well. Try and maintain as much distancing as you can, and wash your hands. Hand washing is really important, especially for folks in the retail industry. So if you're checking customers out, you might not be able to go wash your hands every time, but you can certainly use hand sanitizer in between customers. I'm not sure what to recommend for restaurants. Actually, that's going to be kind of interesting how they figure out how to reopen. I know a lot of businesses already have strategies around this. For instance, the grocery store I go to has all their employees wearing masks, and they ask all their customers to wear one as well. Some businesses have tried to decrease the number of people inside the building at any one time. So I think all those are viable strategies, but I think probably the most important would be the masking and the hand washing.
Thank you so much, Dr. Young. As business owners back into this return to work mentality mode, as they prepare for that, what do they need to know about contact tracing and how it will help ensure a safe recovery?
Yeah, so contact tracing is already part of the strategy. So all labs have to report all positive results to the state, and those go to the county health departments. And right now, the Tulsa County Health Department is actively engaged in contact tracing. I think probably something else that's really important is if you're sick, stay home, and that's probably always a good strategy, but because that can help prevent the spread of any respiratory illness like influenza. But it's particularly important with COVID since it's new and there's not a lot of herd immunity out there. So what folks can do is stay home if they're sick. As testing capacity expands, we'll be able to test more of those folks. Because up until now, with limited testing, the strategy's been, if you're not sick enough to come to an emergency room, we're probably not going to test you. But once again, as we now have developing capacity to test, we'll be able to test more people, and the ones who don't have COVID then can at least be reassured they can assume some duties. But once again, the health departments are already doing some contact tracing. I don't know exactly how much because I'm not in frequent contact with them, but that's something that will definitely be ongoing as we move to open the economy back up.
Thank you, Dr. Young. My next question is sort of twofold. Number one, as we begin, as we have summer, spring is with us now. It's beginning to warm up. With summer arriving in Oklahoma, it's always hot as can be. What impact, if any, do you see that having on the spread of COVID-19? So that's part one. Part two would be, as we then look toward next fall in the winter and it begins to return to colder weather, what impact, if any, will that have?
Yeah, so good question. Typically in the summer, as people get out, things warm up. You have a lot more sunlight. Some of these viruses are pretty sensitive to that, and typically the respiratory type illness, influenza in particular, is very seasonal. And I think the expectation is that COVID will be like that as well. Although once again, it is kind of a novel thing, so maybe not. But I think the expectation is that summer in particular will see significant declines. And I also think the expectation is we'll see more in the fall and winter. Hopefully by then we'll have enough herd immunity so it won't be nearly as big a surge. I think the big fear is that you have an influenza season combined with a COVID season now, and that's a real problem for healthcare system capacity. I can tell you during a bad influenza season, we're already at capacity. So the 2017-18 influenza season was particularly bad. Lots of hospitalizations, and in fact, there were a couple of days during the middle of that season, the peak of that season, when we were out of intensive care unit beds in Oklahoma, not just Northeast Oklahoma, but Oklahoma. And that's kind of a bad situation to be in. So we'll kind of wait and see how it plays out. Hopefully we won't reach that point. Like I said, hopefully we'll have enough herd immunity, we'll have enough testing, we'll have enough people wearing masks and washing their hands so that it won't reach that point.
And I'm assuming that come the fall, you'll be advising everyone to get a flu shot.
Oh yeah, definitely. Yeah, definitely.
And then what are you now hearing from the Ascension folks as well as other healthcare leaders again as to how soon you think ultimately a vaccine will be developed?
Gosh, I don't know. There's multiple vaccine trials ongoing, and typically a vaccine would take quite a while to develop based on the the FDA rules. I'm sure they'll try and fast track this vaccine, but you need to know it's safe before you get it out there. So some of these vaccines have potential side effects, and you just want to make sure it's reasonably safe before you get it out there. But probably at least 10 months and probably a little bit longer.
One of the things that the mayor's economic recovery task force that's met twice over the past week since it's been assembled, your CEO, Jeff Nowlin, serves on that group. One of the things that we've been talking about, obviously, is the importance of trying to ensure safety to the best of our ability for our employees as well as our citizens. So my question to you really has to do with Dr. Young as an individual, as a citizen of Tulsa and Northeast Oklahoma. Do you feel comfortable? Do you think you'll feel comfortable in the month of May to go to grocery stores, to go to the mall, to go shopping, to go to restaurants? What's your personal gauge on your comfort level of trying to return to begin a little bit of a return, somewhat of a normal life?
Yeah, so I feel comfortable. I've been going to the grocery store ever since this first started, and occasionally have to go to other places to get stuff done. But yeah, I'm comfortable with the idea. Once again, there's quite a few more masks available than there were 8 weeks ago. But even a simple cotton mask can block out up to half the virus particles in the air, and these sort of paper surgical masks over 80%. So once again, masking is important, but it's equally important to do good hand hygiene and keep your hands clean. So, but I feel comfortable with the idea, and once again, the masking is the most important when you're in an enclosed space.
Right. Speaking of enclosed spaces, one of the that is so vital to our Northeast Oklahoma, Tulsa, and really state of Oklahoma economy is airspace. Certainly here in Tulsa, American Airlines and all of our other key aerospace and aviation partners. How do you feel safe now, or how long will it be before you think you would feel safe to get on an airplane with your family and fly anywhere in the continental U.S.?
Gosh, I don't know. I'd get on an airplane now with a mask.
You can pretty much get on an airplane now in a mask and almost have a private plane because there's nobody else on there, and there's nobody in the hotels.
Yeah, in fact, our lead infectious disease physician flew to Atlanta and back the end of last week with a mask. He was perfectly comfortable doing it. So,
but your advice would be, if you're going to go get on an airplane or you're going to go anywhere, you should have a mask on.
Yeah, I think that's reasonable advice at this point. Yeah, and it's not like they're hard to come by. Amazon's got them listed. They'll send you a box of 50 of them in 48 hours. So they're out there. They're available.
I guess that ties into my next question, and that really has to do with something that we've all heard a ton about, and that's PPE, personal protective equipment. From the Ascension perspective, from the Ascension St. John perspective, what is your outlook for the future supply of this very important equipment?
Yeah, I think our outlook is pretty good at this point. We, being part of Ascension, we can source stuff from all over the world. It's a pretty big system, but our outlook is good at this point, and we think we have plenty of personal protective equipment. So we're okay on that score. Once again, so I think we're okay on that score.
Do you think that businesses, and this is another thing that our Mayor's Recovery Task Force is talking about, do you think that businesses in this community, as they begin to reopen, if they need that type gear, that type equipment for their employees, that they can easily access that as well?
I don't know the answer to that, but I think my sense is just the pleated paper masks and the gloves are available. So
okay, sounds great. Thank you so much, Dr. Young. We've only got time for one remaining question, and I will go back to Debbie with Stride Bank to ask Dr. Young our final question. Debbie?
Yes, thanks, Mike. So, Dr. Young, you talked about your confidence about us beginning to relax social distancing orders, and I just wanted to know how you view Oklahoma's testing capacity across the state. I know in the beginning, some areas had more than others, and just wanted to know if you think that has been adequately spread at this point.
Yeah, I can't answer for the rest of the state, but I think the capacity is pretty good here in Tulsa now. And once again, everybody's adding capacity as fast as they can. I think the companies that make these testing materials have done a good job of expanding it and making it available. But I just want to add quickly that this kind of diagnostic testing is not easy to do. It's very technical and very difficult, and you have to be sure you do it right. So, and I have confidence in the laboratories associated with the hospitals in Tulsa that they're doing it correctly. So we are getting ramped up and should have plenty of testing capability.
Dr. Young, Debbie Blacklock of Stride Bank, thank you both so very much. Dr. Young, we appreciate you. We appreciate your Ascension St. John partners, as well as all of our healthcare partners, for the extraordinary job that they've done in helping us as a community address this COVID-19 crisis that we've been going through for the past month and a half or so, 2 months. And so thank you for all you're doing and all you're doing to help lead the medical community there at St. John.
Yeah, let me just say, I agree that the folks on the front lines have done an incredible job. So kudos to them.
That's all. Absolutely. Thank you, Dr. Young. Again, a special thank you to our sponsors at Ready, Luxa Enterprises, Security Bank, and Stride Bank for making today's webinar possible. For anyone who came in late or called in by phone and would like to share this webinar, a recording will be posted on our Chamber's website later this afternoon. That will be available for you to share and for others to access. Our next business support series webinar will be tomorrow, Thursday, April the 30th at 11 a.m. We'll be joined by two very bright young educators. That's Jenks Public School Superintendent, Dr. Stacy Butterfield, and Impact Tulsa Executive Director, Paulisha Bradley, for a 30-minute discussion about what's next for public education in our state, and specifically for public education in Northeast Oklahoma. You can register for that webinar by going to tulsachamber.com/events. And again, if any of us, if I personally or any member of our chamber team can assist you or your company as you continue to address this crisis and really begin to look at how your company might return to work, if we can be of assistance to you in any form or fashion, please reach out to us. And again, thank you to Dr. Young, to Ascension St. John, and to Debbie for being with us today. Hope you guys have a wonderful day, a great afternoon, and we look forward for you hopefully joining us again for tomorrow's webinar. Thank you and have a good one. Bye-bye.